Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. So, two MDs are with me. Anyway, we are conducting this class of Roganidan and Vikruti Vidyan. This is the subject for the second or the third year BMS. And today we are talking about one of the important aspect regarding the clinical examination as per the Ayurvedic perspective. When I say clinical examination, there are two things. One is a modern type of clinical examination, and another is Ayurvedic type of clinical examination, and sometimes the mixture of two. There are very interesting videos in my mobile app. So I request all of you, there is a mobile app of Professor Deshpande. The naming same, Ayurveda Academy is the name of YouTube channel. Ayurveda Academy is the name of the mobile app. Is available on the Google Play Store, and there you can purchase that program of clinical examination. There we have the fantastic videos and the PPTs about the nervous system examination, cardiovascular system examination, pulse examination, respiratory system examination, gynecological examination, every video, ENT examination, pediatric examination. So please see all those videos in that particular very optimal price is there. Anyway, coming to the point, in Ayurveda, there is a pattern of the examination, practical examination I am talking about, for the Roganidan subject as well as especially the Kai Chikitsa subject. They ask you to examine the patient, and they will provide you the patient of Shwasa Vyadhi. They will give you the patient of Udara Vyadhi, that is ascites. They may give you the patient of the paralysis or hemiplegia, Pakshaghat in Ayurveda. So these are the 2-3 important diseases. Always the cases are given on these particular cases, like a Shwasa or the bronchial asthma, ascites or the Udara Vyadhi, then the Pakshaghat or the hemiplegia. So actually there is a short case of 20 minutes. Your time will be only 20 minutes. And there is a long case that is of 45 minutes. Then you will ask me, sir, what is the difference? We have to examine the patient. Yes, but my dear friend, although the basic things are same, like name, gender, occupation, age, address, these basic things, then Vedana Vishesha, which are the chief complaints, Purva Vyadhi Vritta, previous diseases, Kautumbik, Kulaja Vyadhi, that is a family history. So all these things, basic things are the same. But then, if you have only 20 minutes, then you have to do in the short case, that is called as a short case. There we have to do Ashtavidha Pariksha only, and only defective Srotasa examination. For example, if there is a patient of Pakshaghat, hemiplegia, then Ashtavidha Pariksha is there, but you have to check only Majja Vah Srotas. Second example I will give you. If there is a patient of Shwas, bronchial asthma, then you have to go to the patient and do Ashtavidha Pariksha and only Pranavah Srotas Pariksha. This is about short case, 20 minutes. What about the long case? Long case, everything is the same. Ashtavidha Pariksha and previous thing, but you have to examine all the 13 Srotasas. 13 Srotasas, everything, whether it's a normal, whether it's abnormal, you have to check it. That is called as a long case. So in this today's lecture, I have explained what is short case, what is long case. So kindly remember this point. So Ashtavidha Pariksha is useful for short case, basically also sometimes useful in the long case. Now, knowledge of sometimes there is some, because of the scanning process, I kindly excuse me, there are some words are not clearly visible, but I will tell you what are those words if the difficulty arises. So be relaxed, comfortable, and try to see this particular understanding. Knowledge of Ashtavidha Pariksha and its importance. Again, open your notebooks. Today's date is the 15th. Happy Makar Sankrant. Everybody, every my viewer, happy Makar Sankrant. Today is a Makar Sankrant. Tilgul Gya, God God Bola. Take the tilgul and speak sweet. So this is a til is a sesame oil, which is very essential in the winter season. Fatty substances are useful, and jaggery is a hot in nature, Ushnavirya, because we have a lot of cold here in the winter season. So we have two things. One is a dryness is there, sesame oil is there, and one is a cold is there, jaggery is useful. So at a physical fitness for the homeostasis, Tirgul is best in this winter season. Number one. Number two, that when you prepare that Tirgul, there is a pak, that means jaggery and this mixture water, then it is like a sting is coming. That pak sankalpana in Ayurveda, that stickiness is joining the two molecules. Similarly, it is a symbol that if we want to unite two enemies, two friends, union is there, then you have to this symbol Tirgul, because it is anxiousness, fattiness that will stick your love and affection with each other. That is the importance of Tirgul. So whenever we celebrate any festival, try to understand the logic or the science behind that particular things. Okay. So again, coming back to our own topic, that is Ashtavidha Pariksha. Ashta is 8. Write down the topic. Ashta is 8. Pariksha is the examination, that is clinical examination. Importance. Now, as you know, my habit that whenever I start, I do the marking so that the students can concentrate on that part. Okay. Roga kranta sharirasya sthanani ashtau nirikshayet. Sthanani ashtau. See the cursor. But this is most important, is this reference. Please write down immediately. Ashtavidha Pariksha is mentioned in the Yoga Ratnakara. This is the name of the textbook, reference book of Ayurveda. Yoga Ratnakara Ashtavidha Pariksha. Yoga Ratnakara Ashtavidha Pariksha. Don't forget that. You write down whenever any question about Nadi Pariksha, Mutta Pariksha, write down Yoga Ratnakara. Yoga Ratnakar has exhorted to examine 8 elements in our body while doing the Rugna Pariksha. There are 2 types of, the patient examination and the disease examination. In this, your first term examination, there are 2 points. Roga Pariksha, Rogi Pariksha. Disease examination, patient examination. In disease examination, you have Nidana Panchak. Don't forget that. Nidana, Pururupa, Rupa, Upashaya, and Samprapti. There will be 100% question on Samprapti. Types of the Samprapti. Vidhi Samprapti, Bala Samprapti, Kala Samprapti. You have to prepare pathogenesis, how the disease takes place. Shatakriya Kal, Chaya Prakopa Prasara, Thana Sonshare Vyakti Bhed. And second is a Rogi Pariksha. And in Rogi patient examination, Ashtavidha Pariksha is very important. 2 things are important. In this examination, there is no Dashavidha Pariksha. But remember my words. Ashtavidha Pariksha is important. Also, Dashavidha Pariksha is also important. But that we will see afterwards. So, which are the 8 points? Immediately, one after another, you write down. My dear friends, please write down keywords. First examination, Nadi. Nadi Pariksha. Here, Nadi Pariksha. Radial pulse examination. Sometimes I will use modern terms so that it is easy to understand. So, Nadi Pariksha is a pulse examination, Ayurvedic perspective, Nadi Pariksha. Second, number 2, Mutra Pariksha, urine examination. Number 3, Mala Pariksha, Purisha examination. Write down. I will wait. 1, 2, 3, 4. Jiva, tongue examination. Jiva, tongue examination. Shabda, Shabda, sound, that is auscultation. Please write down. Auscultation, auscultation with the stethoscope. Lung sounds, heart sounds, peristaltic sounds. Everywhere there is a sound. That is Shabda Pariksha. Sparsha Pariksha, touch. Touch. Oh my God, fever is there. Hot temperature, tactile sensation. So that is, Sparsha is a palpation, percussion. Palpation, percussion. Remember this thing. Touch and percussion, you note this. Here, tuck, 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 tuck. Liver dullness, tympanic sound in the abdomen, resonant sound in the lungs. So this is Shabda. Okay. Netra, eye examination as well as examination done with the eye. Examination done with the eye, pratyaksha pariksha. Okay, and akriti, the patient's overall body frame, how he looks like, thin, obese, that is akriti. This is general. But if I have the tumor here, I will see what is its shape. It is a circular, it is irregular, it is cauliflower growth. So different shapes, different colors, that is akriti. Okay. The examination of these is very important to have the comprehensive knowledge of the Vyadhi. I will say it's better to have the understanding of the Vyadhi as well as the patient. Mostly it is related with the patient. Okay, next. First of all, a Vaidya should conduct Nadi and Jiva Pariksha. Then only he should go for the treatment. So always examination point is first, treatment is afterwards. So if anybody asks you, sir, tell me, give me the treatment for cough. No. First, online, offline, you have to do the examination. After examination, after provisional diagnosis, after final diagnosis, then you treat the patient. Avastha vichar. A Vaidya who does not do is unable to procure comprehensive knowledge regarding the Vyadhi bala, Roga bala in this whole entirely. Such Vaidya becomes a cause of death for the patient. So that doctor is not good. Okay. We will start with the Nadi Pariksha. Can you see here? Yoga Ratnakar. Examination of pulse. Vaidya should place his right hand fingers on the base of the thumb. Can you see? This is thumb, base, radial artery. Right hand of the patient. A Vaidya should keep his mind calm and poised and focus on the Nadi Pariksha. Okay. I will take only important points. I am not going to stress each and every point. Method of pulse examination. Now there are some dispute points. Some people agree and modern science don't agree. A Vaidya should examine the Nadi in the left hand for the female. Left hand for the female. At moment you write down left hand for female and right hand for male. But this is not acceptable by every Vaidya. This is not accepted by the modern science because both the side pulse are same. Nothing to be worried about. If it is uneven on this right and left, that is a problem. So equality, we test the equality right and left. But some original text they have mentioned for the female left hand, for the male right hand. Examined hand should be placed such a palm faces upwards like this, and we are examining like this. Can you see? See my video, that will understand. With fingers spread, patient should not be suffering from any pain or deformity in that hand. Here there should not be any trauma, pain. Whenever you are doing examination of this left hand or right hand, then there should not be problem with that hand. Ideally, a Vaidya should examine Nadi for 3 times and then make a conclusion. Okay. Now, Nadi Parikshan Kal. I will request whenever we are going, there are some bold lines. Either there are 2 ways. One has to screenshot of every thing, or otherwise you write down the title, Nadi Parikshana Kal, time for examining the pulse. The Vaidya should examine the pulse early in the morning, at dawn. In Pune city, I am proud that there was late Paramapuj Vaidya B. P. Nanal, Bhapu Nanal. Best Vaidya in the Ayurveda fraternity, very intelligent, very senior, very experienced. And I know I was his student. So he always asked the patient to come into his clinic in his house early in the morning. Immediately after getting at home and then cleaning all these ritual morning brushing and toilets and all this, come to my clinic. Then he used to examine empty stomach, early morning pulse, Vaidya Bhapu Nanal. I know that. See, even today, many Vaidyas ask the patient to come in the morning on empty stomach and then they do the pulse examination. So this is very interesting. Next. Title you write down? Here. Nadi Parikshana Anhar. That is Anhar, this Sanskrit word. Contraindication for pulse examination. When the Vaidya or the doctor, unless and until emergency, because we cannot say, oh, I will not examine because the patient is already problematic, unconscious, tremors, epileptic fits, breathless. So we have to do the examination. But unless and until there is emergency, you should not do the pulse examination. When? Nadi should not be examined in the following conditions, and it will not give the proper knowledge of the disease. For example, if you examine the Nadi after bath, no correct answer. After meal, after food, no correct answer. Immediately after doing massage, oil massage, snehana, don't examine the pulse when the patient is thirsty, when he is asleep, immediately after he gets up from the sleep. No. So these conditions are not useful for pulse examination, Nadi Pariksha. This is called as a contraindication. Okay, next. Nadi Pariksha and Dosh Vichar. This is very important. Please write down Nadi and Dosha. Nadi and Dosha. Okay. So we examine the Nadi with the 3 fingers. Can you see cursor? One, this finger, index finger, index. Second, middle finger. And third, ring finger. These 3 fingers, please note, these 3 fingers, they indicate Vata, Pitta, Kapha. Vata, Pitta, Kapha. 3 fingers, 3 doshas. Okay. So we can compare those quality of that Vata, Pitta and Kapha with these fingers. Now, this is also asked for the oral. You write down this for oral. For oral, this topic is important. Dosha and Nadi Gati. I am going to dictate you. Dosha and Nadi Gati, very important. For example, Vata is having Sarpanadi, serpent movement. Vata, serpent, like how the snake is moving, like this and this. You remember? So when we take the pulse, you will get the first finger, there will be pulse. Second, there will not be pulse. And third, again the pulse. So it's like a zigzag manner. It is called as zigzag. This will, at one finger it will be there felt, another no felt, again felt. So this is zigzag manner. Vata, Sarpagati. Vata, Sarpagati. Very fast. Pitta. Pitta ka Manduka Gati. Manduk. You know how it jumps? So in this, you will get the first finger and the third finger. You will get the pulse. In the middle finger, no pulse. Because it is jumping. Jumping. Manduka Gati. Only these words. Don't forget about other. Forget. Only Vata, Sarpagati. Pitta, Mandukati. Vata, Sarpagati. Pitta, Mandukati. And Kapha, Hausagati. Hausagati. Very slow and steady. Hausa. Hausagati. So these Sarpa, Vata, Pitta, Manduk, Kapha, Haus. Always make learn by heart. Then Vata, Pittaja, Sarpa and Mandukati. Pitta, Kaphaja, Sarpa and Hausagati. Pitta, Kaphaja, deer and Hausagati. Sannipatik, woodpecker bird like Gati. Woodpecker bird. Sannipatika. But I think that is not much important. Now, this is the next topic, that is Asadhya Nadi Gati. Asadhya. Asadhya Nadi Gati. A Nadi which pulsates for 30 seconds at one place and then becomes slow at its own place is known as Asadhya. Incurable, the disease is not properly curable. It may be serious disease. Okay. There are different parameters for that because it is normal and then again coming down. It's like a bradycardia. Normal pulse rate, write down in the comment. Otherwise, I will tell you right now, 72 per minute. If it is a less, bradycardia. If it is more, tachycardia. Dhrutagati, Mandagati, Ayurvedic words. Mandagati, Dhrutagati. Tachycardia, Dhruta. Dhruta is a fast. Manda, slow. And Vata is a Vishamagati, arrhythmia, irregular, arrhythmia. That is Vata. Whose Gati is Manda, whose Gati is a Durbala, very weak pulse. Chanchala, irregular. And Sukshma is said to be Asadhya. Okay. Next point about the Mrityu Suchaka. See, very, very important. Yoga Ratnakar is saying about Nadi. Mrityu Suchak. Mrityu is a death. Fatal movement of Nadi. The Nadi which pulses with gap. Thak, 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 thak. Love, dub, love, dub, love, dub, love, dub. That is normal. Love, gap, dub. Love, dub, gap, love, dub. So if there are gaps, that is called as arrhythmia because of the ventricular abnormalities, and that is supposed to be the fatal. Okay, now we will go fast. A Nadi with a Gambhira Gati. Other Lakshanas of the Nadi. We are still discussing the Nadi. Yeah? Remember, there you should check a Nadi with Gambhira Gati is said to be Mausvahi. Mausvahi. Nadi Gati is rapid and Ushna. In which condition? Fever, hot and fast. Rapid in calm and krodha, anger. Pulse rate is high. I will kill you. Pulse rate is high. When the person is thinking in that way, very angry, his pulse rate, sympathetic stimulation. Kshina, very weak in the chinta, tension, especially depression and bhaya, fear. In fear, phobia, depression, Nadi will be low. Manda in mandagani, when your digestive fire is not correct, proper metabolism is not there, there will be slow pulse, mandagati. And dhatu kshinata, rasakshaya, raktakshaya, anemia. You check the anemic patient's pulse, it will be the little bit manda on the lower side. Okay. Now, here are the same description, though I will not go into that. Here you can see, Arogya Suchaka Nadi, health indicating pulse. Till now we have seen the fatal, asadhya, prognosis is bad, sadhya, sadhyatva. But here a Nadi which is of Hamsa or Gajagati, very slow, systematic, disciplined, felt on the deep palpation, and the appearance of the Rugna is cheerful. Like Deshpande is always smiling. That indicates that Nadi will be healthy Nadi. Okay. Importance of Nadi Pariksha, all is given in the Yoga Ratnakar. Can you see here Yoga Ratnakar? So, Angushtha Moola Bhage, Angushtha Tham, Angushtha Moola Bhage, Ya Dhamani. You try to learn this shloka by heart, very important shloka. That is like a definition of the Nadi. Angushtha Moola Bhage, Ya Dhamani, artery, Jiva Sakshini. When there is a pulse, we say that the patient is alive. Whenever we go to visit, do the home visit to the patient, when the patient is very serious, what we see first? What we see first? We see the pulse, we see the blood pressure. Am I right or wrong? Yes. Pulse and BP are most important whenever you visit to any patient, at any home. If you are seeing the patient as an emergency, don't forget to see the pulse and the BP. That's why it is Jiva Sakshini. When the pulse is not palpable, OMG, oh my God, patient is going to die. Jiva Sakshini. Tatcheshtya sukham dukkham neyam kayasya pandidai. The pulse felt at the base of thumb is a Jiva Sakshini. That is a proof of life and used as a direct indicator of Vyadhi. Nadi Gati helps one to understand the patients of Sukha or Dukkha, health or the disease. According to pulse, we can diagnose the conditions. Next. Next, we will go directly with the Ayurvedic Mutra Pariksha. I'm sorry. Just give me a few seconds, my dear friends, as you know very well. Yoga Ratnakar has described the 8 sthana, 8 elements of the body to be examined for the Vyadhi Vinishchaya. Mutra Pariksha is one of the important Ashtavidha Pariksha. So if you can be asked as a full question LAQ, describe Ashtavidha Pariksha in detail, 15 marks. Or you may be asked only Nadi Pariksha, SAQ for 7 marks. You can be asked only Mutra Pariksha, SAQ for 7 marks. Any Pariksha, if you are asked, you first write down the sentence, Yoga Ratnakar has given these Ashtavidha Pariksha. These points are, write down all the 8 points and then start Nadi Pariksha or then start Mutra Pariksha. Even if the Mutra Pariksha is asked, don't write immediately Mutra Pariksha. No. Give some introduction. and then start Mutra Pariksha, urine examination. Mutra Sangrah Vidhi, very important. How you should collect the urine. A Vaidya should ask the patient to get up early in the morning, 1 hour before sunrise, and void his urine in clean and transparent glass vessel. Very important, sterile. The most important, Shuddha, sterile bottle should be there. Mid-stream urine. This word is very important, my dear friend. Please write down. Mid-stream urine. So what is that mid-stream urine? You start passing urine, first few seconds, stop, then hold the bottle and pour the urine over there. Again, take the bottle out and void the remaining one. So that is called as the mid-stream urine. Starting to pass the urine. First few, toilet, then collect in the bottle, middle part, and then again in the toilet. So this is called as the mid-stream urine. Word is important to be collected, and the first and last few drops should be discarded, so as to avoid the vikruti in the bahya mutra marga and precipitation of mutra in the vessel respectively. Okay, forget about those lines. Now, Ayurvediya mutra parikshan, these are the points. Ayurvediya mutra parikshan. Pariksha. If you touch to the urine, it is always ushna after voiding urine. Ushna. Why? It contains the H plus ions. Very interesting. Urine contains H plus hydrogen ions, and that's why this is acidic. Urine is always acidic, and because of the acidic, that is Ushna. Ushna in Sparsha. Varna is always yellow, pale yellow. The normal color is a Pita Varni, because of the little amount of what you can say, the specific components from the bile salt and bile pigment. It's not bile salt, it's not bile pigment, but some other components which give the color to the urine, that is pale yellow. But if bile salts and bile pigments present in the infective hepatitis, in the jaundice, in the kamala, the urine will be, yes, high colored. Write down. Gadat piula rang, dark yellow. That is called as high colored urine. Gandha, having the specific mutra gandha. Sam and Niram examination is ascertained by the mutra gandha. Sama mutra is this one, Durgandhi, and Niram mutra is little bit devoid of the odor. There is no specific odor, but if it is very bad smell, that is Samata, indicating Samata. Okay. Praman is said to be 4 Anjali. Anjali, 4. This is very important for the post-graduation MCQ. Mutra Praman, 4 Anjali. Anjali is a handful. This is the measurement of liquid. Like today, we are measuring the liquids in the milliliter and liter. At that time, Yoga Ratnakar time, the liquid measurement unit was Anjali, handful. This is Anjali, 1 Anjali. 1, 2, 3, 4. 4 Anjali Mutra. You can, I always tell the students, be what you can say, curious. Curiosity should be there. So you can bring the plastic measuring cylinder, simple water or your tap water you should collect in the hand, pour it in the measuring cylinder. 1, 2. And you can tell to the examiner, yes, sir, I have measured 1 Anjali in my hand, and that is, say, for example, 20 ml or 25 ml. And then 4 Anjali means at the one stroke, how much urine the person can pass. It may be approximately 200 or something like that. Okay. Mutra Vriddhi and Mutra Kshaya is depend on the Mutra Pramana. Vriddhi is excessive and Mutra Kshaya is a deficiency of passing the urine. So these are Charak Sutra Sthan, specific shlokas are there. Can you see? No, better way I will mark it again so that it will be very well understood. Mutra Kshaye, Mutra Krichra, difficulty in urine. Mutra Krichra means, burning, dysuria, burning urination, that is Mutra Krichra. Mutra Vaivarnya, high colored, because salts are more, water is less in the summer season. Mutra Vaivarnya, discoloration. Pipasa, always quite thirsty. The person is always thirsty. Mukhascha parishishyati, dryness in the mouth. So these are the mutra kshaya symptoms by Charak Sutrasthan. In case of the mutra vriddhi, mutram basti nistodam, krute api akrita sadnyatam. What is happening? Increased frequentation of urine, basti vedana, urinary bladder pain, lower abdomen pain, adman, and feeling as if the urine has not passed after avoiding the urine. Again, frequency and quantity is too much increased. That is called as a mutra vriddhi. Okay, let us go further. Then there is very interesting topic. It is also asked for many times for the ACQ. Please write down important question. Come on, come on. Taila bindu pariksha. Taila bindu pariksha. Please write down. Very important question. Afterwards, you will say, oh, sir, you had mentioned that, but I have not studied. No. Taila bindu pariksha is very important for ACQ 7 marks. Important and specific mutra pariksha examined by the Ayurvedic classics apart from the above mentioned pariksha. Taila bindu pariksha, taila is oil drop. Understand the specific increase of doshas in the mutra, and it will also indicates the sadhya sadhyatva. Why Dr. Deshpande has stopped? Because I want to dictate you. Importance of, write down, importance of Taila bindu pariksha. Importance of Taila bindu, oil drop examination. Two things. One, to decide dosha vikriti, which dosha is problem. Dosha vikriti, abnormality in the dosha. Second reason, we can understand the sadhya sadhyatva of the disease, prognosis of the disease by Taila bindu pariksha. Yes, we are going to see how it is done, what are the results, but these are the two important things about Taila bindu pariksha, Yoga Ratnakar, Ashtavidha pariksha. Okay. Procedure of Taila bindu pariksha. Here, can you see? Take a flat glass vessel, mark the 8 directions surrounding east, west, south, north, east, west, north, northeast, east, south, Agneya, Nairitya, Vayavi, Ishanya, 8 dishas. You have to mention that. Then take a flat glass vessel, mark the 8 directions surrounding it. It should be kept on a plain surface of an area protected from the air currents. There should not be too much wind. Fill it up with urine sample to the brim. That vessel, you have to take the urine in that vessel. Allow the mutra to settle. Drop a single drop of sesame oil from a height of 2 inches with the dropper. Here is the urine. Here is a sesame oil. This is a dropper. Here is the urine. Are you getting my point? I am putting the drop sesame oil. That is Taila bindu pariksha. From height of 2 inches with the help of glass blade or the dropper. Observe how the oil behave. What is happening with the oil? Whether it spreads or go down or float in the urine. 3 things. Spreading, going down, spreading. Okay. So spreading or down or floats. The conclusion helps the Vaidya for the diagnosis. Let us see. Very, very important table, my dear friends. Very important table. For practical oral also. If the oil spreads, sadhya vyadhi, curable. Then oil remains sthira. Does not spread, only there only. That is kashta sadhya, difficult to cure. This is the research topic. If you are doing MD or MS, take this topic. I appeal you, all the viewers, take this topic, Taila bindu pariksha, for the research. MD in Roganidan, MD in Kaya Chikitsa, MD in Kriya Sharir. Do this research and take the samples from the different hospitals, and you will find the interesting results. I have done personally that research. Oil remains sthira, does not spread, kashta sadhya. Oil go down. That is asadhya. Oh my God. So simple thing research I can suggest you. If you are visiting to any doctor, huh, if the patients are there cancer, I will request to all my subscribers and viewers, take the cancer, because it is non-invasive research. We do not have to puncture, we do not have to operation the patient. We just have to collect the urine samples of the cancer patient, 100, 200, 500, and do this test and find it out whether it's going down or not. Because cancer, especially with metastasis, is always incurable, asadhya. You can take the HIV patients also. Huh? Okay. Now, Disha, according to the how it is spreading. How it is spreading. Nishkarsha, conclusion. Oil spreads to east, Sukha Sadhya, prognosis. Oil spreads to south, that is maybe Jwara Vyadhi, Kashta Sadhya. Oil spreads to the north side, Sukha Sadhya. Oil spreads to the west, Sukha and Arogya. Oil spreads to the Ishanya, that is northeast, death. Oh my God, within a month. Very serious. Huh? One has to make the research. Then oil spreads to the southeast, that is indicator of death. Oil spreads to the southwest, indicator of death. Oil spreads to the northwest, death shall occur definite. So these last 4 points are a little bit dangerous. Agneya, Nairatya, Vayavya, Ishanya. These are the names in Marathi. Okay. Now, how this oil drop, sesame oil drop looks like. Many holes punched in the drop of oil akin to the sieve, like a sieve, you know. Marathi आम्ही त्याला चाळणी म्हणतो, चाळणी, sieve. Lot of holes are there. So that indicates the Kulaja Vyadhi, genetic disorders. Oil drop appears like a serpent snake, that is Vata dosha. Oil drops appears like a umbrella, you know the umbrella, that is Pitta dosha. Oil drop having no particular shape, Kapha dosha. Hole in the oil drop processed by Pishach or demon, that is microorganisms, infectious diseases. Okay. Next is a determination of dosha predominance according to Mutra Varna. If that Mutra Varna is a whitish, indicating Vata. If it is Rakta Varna in the urinary calculus, Mutkhada, Ashmari, that is Pitta. Shweta Varna indicating Kapha. Krishna Varna indicating Sannipataja. Okay. Then Malam, Nadi, Mutram, Malam, Jiva. Third, we are now in the third, Mala Pariksha. Okay. Here, Mala becomes Grathita, hard, lump formation, Shishka, dry due to the Vata Prakop. Constipation is always with the Vata. It appears Pitta Varna, yellow due to the Pitta Prakop, little bit liquid. If it is a Shweta Varna, whitish, it is Kapha Prakopa. Yoga Ratnakar has mentioned the above description originally described in the Rudra Tantra. Next. Sannipate cha sarvani lakshanani bhavanti. A combination of Mala Lakshanas described above is found in Sannipataja. What is Sannipataja? Everything is there. Vata Prakop is there, Pitta Prakop is there, Kapha Prakop is there. Tridosha Prakop is called as a Sannipataja. Okay? In Vata Pradhan dosha, Lakshana like Dravamala, then Safena, foamy color, Ruksha and Dhumavarna, Grayish Mala Pravrutti occurs. Okay, let us move further. Now, dosha, pradhanya, predominance, and the characteristics of Purisha, stool examination. Vata Kapha, it may be slightly black. Pitta Vata, it is like a formed stool. Pita Varna, yellow Varna. Pitta Kapha, Pita Shweta Varna, Alpadrava, and Pikshila, slimming. If, next is a here, can you see? If Mala Pravrutti is a foul odor, Mala is a Shitala, then it is said to be Jirna Mala, long-standing Mala in the large intestine. Krishna Varna and rounded baby-shaped mala indicates the Kshina dosha. In Jalodhara, the mala is of Shweta Varna accompanied by foul smell. But I personally feel the most important thing about Purisha is a Bhusha Durgandhi. I will say this word 3 times. Bhusha Durgandhi. Typical, very foul smell, indicating Ama, Sama Mala, Sama Purisha. How it is indicated? Very, very obnoxious and very bad smell to the stools and also very stickiness. That two things indicating Samamala. Okay. This we have already seen. I will focus now. Next examination, Shabda Pariksha. Nadi Mutram Dalam Jivva Shabda Sparsha Drukakru. So this is a Shabda or the Swara Pariksha. Swara or the Shabda is Guru in Kafadosha Pradhanya Dushti. Very heavy. The patient, while he is speaking, it looks like a very heavy to pronounce. Then, next is a Sputa Vakta. Clear Swara in Pitta Prakriti. Okay. Can you see over here? We are talking about the Swara. Just I would like to give you the correct, because the lines are not clear. I will repeat for you. That is a Shabda or the Swara Pariksha. I will explain in more clear manner. So if anybody wants to write, they can write it down. Okay. So we are talking about Shabda Pariksha. If the Swara is a Guru, it is Kafadosha Pradhana Dushti. Then Sputa, here, can you see the Sputa? Sputa. Clear Swara is a Pitta Prakriti Vyadhi and devoid of both Lakshanas are Vata Pradhanya Vyadhi. So it is not Guru as well as it is not Sputa, then it is called as a Vata dominant. Okay. Apart from the Shabda Pariksha, here, can you see? Apart from the Shabda Pariksha described by Yoga Ratnakar, Sushruta, can you see here Sushruta? This word is Sushruta. Sushruta has described 3 special Shabda Vikruti. Can you see? Here, Shabda Vikruti. Write down. Sushrut, Shabda Vikruti. Please write down because the matter is not clear. The word is Mukha. Mukha, that is dumb. D-U-M-B, dumb. Dumb and diff. Mukhatva. Then second is a Minmina. Minmina. Sluttering speech. And Gadgada. So these 3 words are used by the Sushruta. Then Mukha can be considered as a mutism. The person cannot speak, mutism. Then Minmina is a sound with nasal twang. Nasal twang. Can you see here? And Gadgada is a stammering speech. Stammering speech. These deformities, Vikrutis, are mentioned by Sushrut, not by Yoga Ratnakar. Mukha, Minmina, Gadgada. Okay. But in addition to all these notes, description, I want to say, when you want to examine Shabda Pariksha, you must examine the respiratory sounds. Shvasana, Shvasa, Swara, Nishwas and Uchwas, Ayurvedic words. Prana and Udana Vayu Gati. You must check it. Yes. Normal sound is vesicular sound. Please write down. Vesicular. Vesicular sound. That is given in my clinical examination, Google Play Store and mobile app. So you can see that. I have explained all these things. So vesicular sound, bronchial sound, what are ronchi, what are ras. In Ayurveda also, please write down. Vataja Dhvani. Please write down. Vataja Dhvani in the Vataja Kas. Only spasmodic bronchitis, spasmodic allergic asthmatic, there will be whistling sound. Whistling sounds, that indicates bronchial asthma. So this is Vataja Dhvani according to Ayurveda. But when the patient is of pneumonia, chhati bharliye balachi in Marathi, there is a huge cough collection in the chest, in the lungs, that gives, write down the word Rals. R-A-L-E-S. Rals means kafaj dhvani. Kafaj dhvani. Rals. In pneumonia, one disease more, one disease more. Bronchiectasis. Bronchiectasis. Are you getting? Wrong, Rals. And previous was whistling is a part of bronchi. Vattajadvani. So Ayurveda mentioned Vattajadvani, Kafajadvani. This is one thing. Then heart sound, Rudagati. That also will decide Shabda Pariksha. Shabda. What is the abnormal in the heart? Which abnormal sound is there? No, no, I am not going to tell you. Write down in the comment. Write down in the comment. What is the abnormal heart sound? What it is called? Abnormal heart sound. Tell me. Next, peristaltic movements you have to examine by Shabda Pariksha for the auscultation. Then by percussion also you get the sound, tympanic sound. Then another one important sound in Sandhigatavat. In Sandhigatavat osteoarthritis. What is the modern word? What is the modern word for movements during the movements of the knee joint in the osteoarthritis? Write down in the comment. Write down in the comment. What is that word? Movement, abnormal sound is there. Huh? That you have to write down. That is Vattajadvani. Okay. So this is also, then you have to check the voice of the patient. Always whenever there is a rasakshaya, for example, severe vomiting and diarrhea, the patient's voice will sink very, very, very. Water, give me water. Dry ne, mere ko pani chahiye, pani. This voice, can you understand? This is also the Shabda Pariksha. But what Dr. Deshpande's energy and how is, there is no necessity of a loudspeaker. Dr. Deshpande's voice is like a loudspeaker. So this is also Shabda Pariksha. Are you getting? So different varieties are there with the Shabda Pariksha. Okay. Then we will go for Ashtavidha Pariksha. Nadi, Matra, Malam, Jiva, Shabda, Sparsha. Here, can you see? Sparsha. First Ayurvedic aspect. Sparsha Pariksha. Can you see that? Sparsha Pariksha. Pittarogi. Pittarogi bhavet ushno. How it is a sparsha? Ushna sparsha. Vatarogi ja shitalaha. Vatarogi giving you the cold sensation. Leshmalaha sa bhavet ardraha. Little bit ardra, lubric, oil, water is feeling is there. Sparshataha cha eva lakshaye. Yoga Ratnakar. If the sparsha in a patient is ushna, shita or ardra, then it can be diagnosed. Ushna is a pittaja, shita is a vataja, and ardra is a kafaja, vyadhi respectively. You have to write down these things definitely in the examination. But in addition to that, please, my dear friend, don't forget to write down about palpation and percussion. You write down that. No problem. Palpation, sparsha pariksha, according to Ayurveda. If I get a very, very hard kathina sparsha, then it can indicate some tumor inside, very hard. If it is very, very soft feeling, that is muscle tone, you are examining by muscle tone by sparsha pariksha. Elastic or hypertonia or hypotonia, you have to decide that. So sparsha pariksha is not only this one, but there are a lot of things. Touch, pain and temperature. Please write down these things. Touch, 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 pain, P-I-N, pain, and temperature, T-E-M-P-E-R-A-T-U-R. You keep the thermometer. What is that? Keeping the thermometer 98.5 degrees normal, 100 degrees Fahrenheit. Oh, mild fever. Oh, 102 degrees high fever. Sparsha. Thermometer, sparsha. Thermometer, touch. Are you getting? So these are all things you have to mention. Sparsha. By hand, you can do the touch. By the hammer, you can do the touch. Reflexes. What is reflexes? Clinical hammer, bicep. What is that? Sparsha pariksha. Reflex, stretch reflex is a sparsha pariksha. Why we should not hesitate? I know, I understand, sir, but the question is about Ayurvedic. Yes, I know. First, you write down Ayurvedic maximum, And then if the time permits, if time is there, then only you write down this modern aspect also. Otherwise, forget. Okay. Nadi, Mutram, Malam, Jiva, Shabda, Sparsha, and Druka. Can you see here Druka? Druka Pariksha. There are different meanings. I think different meanings one can take. Yoga Ratnakar, but this is specific for Yoga Ratnakar. He has mentioned only this thing. He has mentioned the describes of Netra Guna with respect to the Sharira Prakriti while describing and regarding the Rupa Pariksha. For example, if there is a Vata Prakriti, the eyeballs, eye color, conjunctiva, eye, how it will look like? Smoky, Dhumra, Aruna, Nila, Ruksha. Eyes will be dry. Chanchala, moving here and there. Chanchala. And Antapravishta, going deep. Antapravishta, Sankan. It is called as Sankan eyes. And Raudra, dreadful eyes. This is indicating Vataja problem. Then in Pittaja, there will be Aruna Varna eye. Drishti is eye. Haridra Varna, in jaundice, yellow color. Haridra is a turmeric. Turmeric is yellow. Then Rakta Varna, conjunctivitis or any trauma. Rakta Varna. Then Malina, dirty color or Tikshna, sharp eyes are there. And deep penetrating eyes. When the Pitta Prakriti looks at you, some people, oh my God, how it is looking to me. Very sharp. Then Kapha. Kapha is a different. Kapha is a cool. Shweta Varna is there. Then Shweta Dhavala means bright. Pluta is like watery. Very good water content is there. Then Snigdha is there. Sthira. Then Santha, that is slow and with Kandu. Sometimes there will be itching. That indicates there is a Kapha dominance. Okay. But here again, Dr. Deshpande, I respect Yoga Ratnakar, no problem. Absolutely, I respect. But modern science collaboration or the understanding, you can say with the eyes, what you see in the patient. With doctor's eye, what he is seeing in the patient can be incorporated in the Drushti Pariksha. Nadi, Mutra, Malam, Jiva, Shabda, Sparsha, Druka Pariksha. Tadvat Danvadoshe Bhavet Mishram Turnam Churnam Vilochanam. Here. Just a moment. Here, can you see? Mixed Lakshanas are found in the Dvanvaja Prakriti Persona. Vision should also be assessed under Druka Pariksha with the help of modern technology. See here. For example, we have to examine esophagus, then stomach, and then the duodenum. So what is that test? That test is called as a OGD. Please write down OGD for the peptic ulcer. OGD, that is esophagus, gastric part and the duodenum. OGD is like an endoscopy. Then if there is ulcerative colitis, a large intestine problem, then I can do what I should do. Then also there is a scopy that we call as a sigmoidoscopy or colonoscopy. That always we are using these scopies to find out the underneath problem inside the body. Okay. Sorry, I will try to make this point here. Nadi Mutram Balam Jiva Druk Sparsha Akruti. So Jiva Pariksha. Here, can you see Jiva? Tongue. Tongue is called as a mirror of our digestion. Tongue is always a mirror of digestion. So whenever there is a Vata Prakop, it gives the Sputita. All fissured will be there. Khara, rough, and Sheet, cold Jiva. This is about Vata. Then for Rakta and Krishna Jiva, Varna Jiva in Pitta Prakopa. While it appears pitchila, slimy, and Shweta Varna in Kapha Dosha predominance. So this is about the Jiva. But Jiva Pariksha is having a lot of things. Especially I would add, you write down these things, Sam and Niram. Sam Jiva and Niram Jiva. There is a white coating which is not going out with the brushing. That is remain there, it indicates the Sama Jiva. And if it is very clean, that is a Nirama Jiva. Then there are stomatitis problem. There the Jiva can be pale, indicating the anemia. One of the important modern finding, I will tell you, it is called as a bald tongue. All the test buds features of is already gone and clear, is very, very bald, very smooth. This bald red colored tongue indicates there is a vitamin B12 deficiency, iron deficiency. Remember this. Okay. So Jivva Pariksha is very important in our practice. Then last is a Rupa Pariksha. Nadi Mutra Malam Jivva Shabda Sparsha Druk Akriti. Here can you see Akriti? I'm sorry, I would like to mark in another way. Yes, this is more correct. Now you can concentrate according to the Vata Prakriti, Varna and the Kesh, color and hair are gray in color. Then Tvaka Sputanam, fissure will be there. Hands and palm, there will be fissure. That is Akriti. Cold foods and surrounding, hatred. Hatred is a dvesh. Not liking. The Vata Prakriti people will not like the cold. Winter is bad for the Vata people. They have always a constipation, dryness, this and that, backache, joint pain. Then there is a Chanchalatva in the Dhairya, Smriti, Buddhi and Cheshta. All the activities are very, very fast. Chanchala. They are hyperactive problem is more with the Vata children. Attention deficit hyperactive disorder. ADHD. Separate video is there on my channel. ADHD. Lot of patients comes to us. Sir, my child is hyperactive. Please suggest some Ayurvedic medicines. We are going to pay you. So this is ADHD is very important. That indicates the Vata problems. Nehana, Abhyanga and Shirodhara are very important. We in Pune do this Shirodhara, oil massages. We do all these things in the Pune. Okay. Then Pitta Prakriti, Tikshna, excessive Kshudha, lot of hunger is there. Then Gaura Varna, fair looking skin, Ushna Sharira. Then Tamra Varnya of Hasta, Pada, Mukha and Shaurya, very courageous person are observed in the Pitta Prakriti. It's like they are explaining the Prakriti features. Kapha Prakriti, then there may be little bit overweight, Sthaulya and other gunas like Bala, Gambhir, serious. Then Buddhivan, intelligent person, Sattvavan, courageous person, mind and Satyavakta, frankness are observed in the Kapha Prakriti person. But here I will tell you, my dear friends, again, when we talk about the personality, don't talk about only Prakriti. This is correct, Yoga Ratnakar, correct. But then you can add, you have to check basically height and weight ratio. I will tell you, height and weight ratio, you must write in the Akriti. Then also you see whether it is a body mass index, whether it is a lean or whether it is overweight. Then you observe overall body, whether there are any joint abnormalities or the organ abnormalities, skin abnormalities, hypopigmented patches indicating maybe leprosy, kyphosis, scoliosis, all these things. Then congenital anomalies in the face or in the hands, excessive less fingers, whether the joint has swelling. So you have to observe all these things as Akriti. Even in the abdomen, you find some tumor. Then how is the shape of the tumor? How is the dimensions of the tumor? How is the feel of that? It's a hard, it is a smooth, whether it is a cyst, whether it is a malignancy. That all things are, I personally feel, can be considered even looking the Akriti of that particular tumor. So many things we can talk about clinical examination, but I think in this lecture, in 1 hour, I have tried to complete Ashtavidha Pariksha in a very short and very interesting manner. I wish you very, very best marks in the coming terminal examination, and I wish all the best. Tomorrow we are going to conduct the gynecological lectures about the gynecological problems. So till then, I wish you all the best. Take care and study hard. I wish all the best for all the viewers. I wish that they requested to share this video, like this video, and don't forget to subscribe my YouTube channel. Thank you very much. See you soon.